Something that you've spoken about quite extensively, and it's in the news everywhere, it's difficult to avoid, is the Make America Healthy Again movement.
We have a chronic disease issue in our country, right? And that's clear. We have a food environment in the US that's made up of nearly 70% ultra-processed foods. Millions of Americans are suffering because of it. And so, we want to see Americans healthier. Who doesn't want to make America healthy? Who doesn't want to make people healthy? So they took a page out of the wellness influencer playbook and they used it to galvanize people. They have this reliance on kind of like corrupt scientists and poisonous food additives. It's really a distraction from the real systemic issues that have caused our chronic disease issues and our food environment to be the way they are over the last many decades.
Jessica, it's so great to have you on the podcast. I've been watching your stuff online and I'm so happy with, the amount of reach you're getting, but also the way in which you tackle a lot of the topics that you do cover, whether it's nutrition misinformation, increasing health literacy about basic science, or even just flagging things which are obviously nonsense online and continuing to sort of improve and expand on the depth of content you talk about every single video.
I really appreciate that. Thank you. I find that a lot of people are kind of searching right now for just information that they can trust, and so it's been nice to see like my ability to create that community of people who like care about credible information.
I guess the elephant in the room is, you mentioned the word trust. You're a healthcare professional, I'm a healthcare professional, and it seems like the awkward position we find ourselves in is that despite years of education and ongoing learning, upskilling, and research, it seems there's been a massive erosion of that trust from members of the lay public. Unfortunately, this opens the door to alternative wellness influencers or, other sort of practitioners of maybe not mainstream medical health to then come in and maybe sell things or veer them off the path of science. And, when you have a movement which is different to the status quo. So the status quo in America, as you've outlined, there's rising rates of chronic disease, sedentary lifestyles, and problems with the food environment. And then MAHA, Make America Healthy Again, comes along. And like you said, it's hard to ignore the catchphrase or the title. So almost, if you're against some of the things they stand for, are you against health? So it sort of tribalizes this, topic of nutrition. And I wonder, from someone who's not based in the US and looking in from a sort of an observer perspective, it seems like that whole space in nutrition when it comes to MAHA is very polarized. Even amongst some people I follow, there are people who are very pro-MAHA and people who are very anti. And there doesn't seem to be much nuance and someone in the middle of that almost saying, actually, yes, some of the stuff is good and some stuff is bad. And is there a problem with that sort of tribalism where something like that comes along and actually continues to divide people into camps when actually, like you said, it's a distraction and we should be focusing on other issues?
Yeah, I 100% think that that's a problem. Yes. And I think that we see this a lot on social media. It's like this black and white thinking. So either you're part of modern medicine, right? And big pharma, or you're part of, holistic wellness. And there's no in between. One of the things that I do try to do on my channel and in the work that I do is try to bridge that gap. So I always try to identify, when I hear like people from the MAHA movement speak, like what are they concerned about, right? And then I start there. Okay, here are the concerns. We have this chronic disease issue. We have this nutrition issue, this food issue. Let's talk about the concerns that we agree on. Let's talk about places of agreement. And then let me identify with actual data. And that's what I think, you kind of started this by saying there's this distrust and people don't really know where to turn to for trustworthy information. And one of the things that I think can help in that scenario is to not use an appeal to authority, right? So not just say, oh, because I have a PhD or because I have an MD or whatever it is, you should listen to me. More so talk about the issue with actual data. So, and people are interested in that. They're interested in like, what is the actual evidence? Why do you say that, looking at systemic factors, first of all, what are systemic factors and what does that even mean? So like why is our food environment the way that it is, right? And then actually talk about the reasons and then kind of explain like some of the solutions. So if the problem is our food environment is 70% ultra processed food, why is that? Explain how we got there and then explain the solutions that can help us to overcome it. And I think by taking that approach, it helps bring people in and people are more willing to listen to the information than if you're like, this movement is ridiculous, don't listen to any of them and only listen to me, and not really explaining the why behind it.
I guess on the topic of ultra processed food, like you mentioned, 70% of most people's diet consists of ultra processed food, and it's inevitable in our daily lives to come into contact with that. I mean, I don't think unless you live on a farm somewhere completely excommunicated from modern society and any metropolis, you can't really cut that out completely out of your diet. And I guess, again, some nuance is missing with ultra processed food because there's a movement, again, which focuses on particular ingredients in ultra processed food and maybe not the fact of food policy and the people who create the ultra processed food and how they produce these sort of things. What role do we have to apportion blame to the food industry, food policy, and those big food corporations? Because obviously, we live in a capitalist society. They want to make food tasty and exciting and market it, which, they want to make money, great. But also some of those same practices encourage us to overconsume things, especially children.
Yeah, absolutely. I mean, I think that the blame, essentially, as you say, it's often overlooked. It's like we focus so much on personal responsibility and we focus on, you need to eat more fruits and vegetables and whole grains and protein and eliminate ultra processed foods and from a personal, individual level. And we completely overlook the systemic factors that are setting us up for failure, essentially. And so that's what I like to do with my work is because I've studied the policies behind these things for so long. And I like to explain to people kind of like what are the systemic factors that are making it really difficult for a portion of the population to even reach the guidelines that we create. So for example, maybe I can just define ultra processed foods too for a minute and talk about some of that nuance. So that term comes from the NOVA classification that's used in nutrition research, and it's relatively new. Maybe in the last couple of decades, we've started using it. And it defines ultra processed foods as foods that rely on ingredients or processing methods that you wouldn't have access to. So you couldn't replicate those foods in your own kitchen. And so there's 4 different categorizations. There's essentially like unprocessed, minimally processed, processed, and ultra processed. And so the best way I can explain that is with corn. So if you pick corn from the garden, that's unprocessed. If you have like frozen corn kernels at the grocery store, that's minimally processed. If you have like canned corn that has a little salt added, that's processed. And then Dorito chips would be ultra processed, right? So they are using the corn to create the Dorito chip, but you can't necessarily replicate that Dorito chip in your kitchen. And within the category of ultra processed, there's nuance there as well. So we tend to talk about this when we hear it on social media, like all ultra processed food is bad. And that's not necessarily true. I mean, there are nutrient dense versions of ultra processed foods, like protein powder, for example, is ultra processed. And when we talk about ultra processed foods as saying like we should minimize our intake, generally those are the nutrient devoid. They're really high in salt, sugar, and or fat. They're stripped of fiber. They don't have a lot of micronutrients. Those are the ones that Americans tend to eat a lot of and lead to overeating, right? They're hyper palatable. And so when you think about if you have this food environment that's 70% ultra processed foods, and at least in the United States, we have dietary guidelines, right? And our dietary guidelines say to make half your plate fruits and vegetables. Okay, so we're advising people to eat a lot of fruits and vegetables. Now, over 90% of Americans are not meeting vegetable intake guidelines, and over 95% of Americans are not meeting fiber intake guidelines. And so then you have to look at, okay, why is nobody meeting the guidelines? We're recommending this, that the evidence is there that this would be healthful for health. And so then you look at something like agricultural subsidies. Well, in the United States, the vast majority of our agricultural subsidies, which help to kind of make these crops cheaper go to crops like corn, wheat, and soy. They go to commodity crops.
Okay.
And less than 1% of our subsidies go to what we call specialty crops, which is produce, right? So we're telling Americans eat half your plate fruits and vegetables, but our policies are in direct opposition to what we're telling people. So corn, wheat, and soy by themselves are obviously fine, but what they're used in, at least for food, because a lot of those crops actually, and this is a whole nother conversation, don't even go to human food. They go to animal agriculture and
Oh.
fuel. So like, for example, 40% of corn goes to fuel, 40% of corn goes to animal agriculture. So we're not left with a lot for human feed. But if you just think about the stuff that goes to the human feed, human food, that a lot of that is going into ultra processed foods. I mean, those commodity crops are the basis of these ultra processed foods. So we're artificially making those foods a bit cheaper, and we're keeping produce foods like fruits and vegetables higher in price relatively because of the way that we subsidize. And we also have policies that favor corporations in our country, and so large agribusiness. And what's happened is that has led to kind of the erosion of local food systems in our country. And so that's led to a lot of food deserts. And what a food desert is when somebody doesn't have easy access to fresh fruits and vegetables and meats and things like that. So they rely, I mean, there's a lot of areas in this country where, people go to a dollar store for their groceries or to a gas station for their groceries. And when you do that, you're relying on ultra processed foods. So we're heavily reliant on these prepackaged foods that can travel far because we don't have strong local food systems anymore. And so when you think about telling somebody, make half your plate fruits and vegetables for every meal, and it's just because of our policies, it's not accessible to a lot of people, you're setting them up for failure. And so we have a food system right now that really is very pro-corporation and very anti-public health.
In particularly those underserved areas, low socioeconomic status areas as well, this problem is exacerbated because maybe someone sort of middle class or affluent regions can, buy something online, order healthy meals, takeaway, get someone to cook for them. There are all these options available to someone who can afford it, but actually someone who maybe can't afford it and is reliant on frozen fruits and vegetables, dollar store produce, the problem becomes even more heightened to the point where there may be deficiencies creeping into their diet because of these sort of grassroots problems.
Yeah, absolutely. It's certainly the problem is concentrated in one specific area in the US. So when you think about health from a public health perspective, you have to look at who is most negatively affected. And in the US, it's overwhelmingly low-income people. So low-income people overwhelmingly experience far greater rates of chronic disease, obesity, and overall mortality. So if you look, there's data that shows that if you stratify income groups and you look at the highest income versus lowest income group in the US, there's a 15-year life expectancy age gap between the highest and lowest income groups in the US for men and a 10-year life expectancy age gap for women between those age groups. And so when you're thinking of, okay, from a public health perspective, how are we going to improve the health of Americans? Your focus really needs to be on that group, right? And that's addressing these food deserts, that's addressing economic instability, that's addressing food insecurity, because right now 14.5% of the United States population is living in a food insecure household, including 1 in 5 children. And that means that those people don't always have access to the food that they need to meet their nutrient needs. And so not necessarily their calorie needs, but their nutrient needs. So their micronutrients and what they need to essentially thrive. And so that can be really problematic. And again, that goes back to these kind of food deserts and our food system as a whole, and being able to get people these nutrient-dense foods.
So if we take it back, almost like on a political level, so, often a lot of people say, we know that things like alcohol, tobacco, they are carcinogens. And we have a lot of studies that show that these are carcinogens, but they still are widely accepted in society. They're marketed, they're sold. And a lot of the reasons for that is because they have huge corporate lobbying, a lot of funds to make sure that they still survive as an industry. It's a multi-billion dollar industry for both of these things, and they still survive, and they have a lot of sway politically. Is there the same degree of sway for these big food corporations as well in terms of what they do in terms of corporate lobbying?
Yeah, there is. There's big lobby groups for food corporations. They're integrated into nearly everything. I mean, it's really difficult. It's one of the areas when we're talking about systemic factors and what we would change. It is getting kind of money out of politics, is what we say, because a lot of these politicians they receive huge amounts of money from these food corporations, and so then they are more likely to vote in favor of these food corporations, and that's exactly what we see. They have huge lobbying groups, and they lobby for things like lax antitrust laws so that they can have lots of mergers and acquisitions. And right now we see the result of that, and we have very few corporations that own the majority of the food supply. And they lobby for things like lax laws for marketing, so they can aggressively market ultra-processed foods to children and to low-income populations. And that's exactly what they do, because they know that those are their two biggest demographics. So the lobbying efforts are a big problem in terms of why our food system is the way that it is. And it's one area when you look at like solutions, it would be to put limits on that, to kind of not allow these food corporations to have so much power in terms of the policies that are enacted, which are really policies that are benefiting those corporations.
So, for example, on that marketing point, in the UK in 2018, they introduced a sugar tax, which meant that basically for the soft drinks industry, the more sugar that was in their produce, then the higher their tax. So that led to a pretty dramatic drop off in the amount of sugar in a lot of these soft drinks. And that also led to, sort of improved health outcomes as well, according to a lot of studies. And similarly, I think it was in Chile, they reduced the amount of cartoonish advertisements for high fat, high sugar foods. Like, Tony the Tiger was removed from a lot of cereal packets when they were sold in South America and particularly Chile, which also had positive impacts from an epidemiological perspective. Why aren't those same marketing embargoes, placed upon big corporations in America? Does that come back to the lobbying issue again?
Yeah, of course. It absolutely comes back to the lobbying issue. We have in the US, we have local governments that have enacted things like that. And so sugar taxes, for example, on soda or sugar sweetened beverages. This is an area of public health that, that's quite debated. I'm pro sugar tax. I think that it really does. I mean, we've seen data that shows that it decreases consumption of these sugar sweetened beverages, which are really these nutrient devoid foods. If I would never tell somebody like not to drink a soda, because a soda can certainly like work into an otherwise healthful diet. But certainly it's problematic when we see the amount of consumption of these sugar sweetened beverages. And I do think that taxing them, just like you've seen with like cigarettes, a cigarette tax has helped to reduce cigarette smoking. And so, yeah, we have a big problem with marketing at the federal level, just in general. I mean, in the United States, we also market pharmaceutical medications, which is, pretty unheard of in the rest of the world. So I would like to start there as well.
I think, something that I read from you actually, that there's sort of impending or potentially some budget cuts with regards to the SNAP program, the sort of supplemental nutrition assistance program, which we don't have in the UK, but it seems to me essentially some sort of benefit or rations given to low-income families or individuals so they can actually get some monetary assistance with their weekly food shop or whatever it is, which seems a great way to democratize nutrition in a way, at least support someone so they're avoiding mineral and nutrient deficiencies, which sounds great. And if you presumably, have several $100 billion, dollars worth of that assistance program being cut, that's seemingly going to widen health disparities purely because of your wealth status. So how big a concern is that in America?
Yeah, so this is what I mean when I talk about this Make America Healthy Again movement and their focus on these additives. And we can have genuine conversations about food additives, and I would welcome those conversations, but the genuine conversations aren't really being had. It's more calling them poison and distracting from the actual issues. And when I say the actual issues, this is exactly what I mean. So yeah, yesterday, the House Republicans proposed their budget. And so in that budget, they're looking to make cuts in various places because they're going to, I mean, this is another conversation, but they're going to add many $trillion in tax cuts that are going to overwhelmingly benefit corporations and wealthy individuals. But they need to find areas to cut, and they're kind of positioning it as we're going to cut waste and corruption and this sort of thing. And in that budget, there are pretty large cuts to agriculture. And in the U.S., we have food assistance under agriculture, and it's the majority of spend under agriculture. So it's over 3/4 of our ag spend goes to this food assistance, and the majority of that, I don't know exact percentage, but it's around like 65% of the nutrition assistance is SNAP. And so SNAP is the major nutrition assistance program in the United States. It's the Supplemental Nutrition Assistance Program. It was formerly food stamps prior to 2008. And it helps, there's lots of data to show how effective it has been to help it to food insecure households. And the majority of people on SNAP are children and elderly. Children, disabled, and elderly. That's the majority of people. 40% of SNAP alone is children. And so it's a really important program where people are given dollars with these cards. They have like these EBT cards, and they can use them at qualifying grocery stores to purchase their groceries. And one of the budget proposals was to cut about, I think it was $214 billion. I'd have to check back the exact. It was a little over $200 billion from over 10 years from that program. And not necessarily SNAP, it's from ag. But again, I just outlined how like big SNAP is in terms of ag spending. And so you can't cut that much from ag without cutting nutrition assistance. And even the head of the USDA came out and said that yesterday. And so, as you say, one of the ways I kind of have outlined already, like where the issues in chronic disease really overwhelmingly are in the US, and the problem with food deserts and the problem with food insecurity. And one of the evidence-based strategies to improve food insecurity and thus improve public health is to expand food nutrition assistance to these populations. And one of the ways to worsen public health would be to cut from nutrition assistance. And that's exactly what's being proposed right now. Now, if it will go through, the Trump administration, the first Trump administration tried to do this twice. They tried to cut nutrition spending twice, and it didn't go through. We have a different Congress now, though, and it's likely that we'll see some cuts to the program.
I mean, you highlighted that there seems to be this overwhelming obsession with singular ingredients or certain additives in the food rather than looking at the whole food landscape. And it seems like the latest compound or substance that seems to be bullied and the focus of attention right now seems to be seed oils. And I mean, if you look at the data, it looks like a lot of data corroborates that seed oils can in fact be beneficial for heart health. And even though there's data on that, why does there seem to be such a discrepancy in opinions online? Do you think that's because seed oils are found in both products that are healthy and also ultra-processed products, which have been, demonized as well? Is that where this problem comes from, or what is it, do you think?
I tried to look up the origin story of where this demonization of seed oils came from. And the best I could find, I'm not 100% sure if this is true, but the best I could find was it really came out of the paleo movement that happened in the early 2000s, 2010s. And that's when it really ramped up. And then it's very big in like the carnivore world. And so I do think that there's an aspect of it that is coming out of this thought that like animal products are better, right, than in that particular world. And it's just caught on at a more mainstream level because of this idea that seed oils are processed, right? They have to go through this like pretty intense processing of extracting the oil from the little seed. It's like a pretty difficult process to do. You can't just like squeeze an olive and get some oil out of it. You can't do that to a seed, right? So it has to go through this like processing. And because of that, it's pretty, it doesn't have a lot of like redeeming nutritional value outside of the actual polyunsaturated fatty acids. So people will compare it to like olive oil, and olive oil's got some of these nutrients, right? I mean, they're small, but it does. So I think that those are maybe like where this has come from, is this idea that it's really highly processed and then it doesn't have these nutrients. But as you mentioned, like if you look at the actual, first of all, I have a PhD in nutrition science. I never even used the term seed oil until social media. It's really like a wellness influencer derived term. We don't use it in nutrition science. We call them polyunsaturated fatty acids. We call them vegetable oils, or we call them by their specific name, like safflower or sunflower. And we look at the kind of the properties of each oil. But overall, when you look at these polyunsaturated fatty acids from seed and vegetable oils, you see that, like in the nutrition science, it's very clear they are not just not detrimental, they can be heart healthy, especially when you replace saturated fats, a diet that's high in saturated fats, with some of these polyunsaturated fatty acids. So the idea that they are problematic for health just as an oil by themselves is just not supported in the scientific literature. What is a problem is the fact that because they are quite cheap and they are odorless, and kind of flavorless, they're really good in these ultra processed foods. So these corporations are like, oh, cheap oil that doesn't have a strong flavor profile, like olive oil, for example, let's use them in all of our foods. And so because of that, because we are over consuming these ultra processed foods, we tend to be over consuming these seed oils, and the overconsumption of anything can lead to issues.
I guess on the point of seed oils is one thing. Another sort of evolving theme, which has been in parallel, has also been all these other sort of additives and dyes. And most recently, I guess you guys in the US, the red dye 3 has been banned based on evidence on rats that it increases the risk of cancers. I mean, rats are highly likely to get cancer, as far as I'm aware. Anyway, I mean, it's pretty high rate of cancer incidence in rats. So I don't know what the causative mechanism there is, but they've banned it based on that rather than any human link. How dangerous is that when some science, where there's obviously some truth in the science that, X substance has been banned because it does this, and it's obviously something which has been brought forward by researchers and scientists, and then that information going into the public domain, and then everyone's saying, oh my God, this has been banned because it's cancerous. All of these other dyes must also be cancerous. Because for me, this is the same problem with the World Health Organization's kind of, the cancer division, the IARC, which classifies things, in terms of different groups, as per their carcinogenic, possibly carcinogenic, probably carcinogenic. And then that sort of scientific discourse being wrongly interpreted and translated to the public, where they think, oh my God, everything is cancer causing, like aloe vera, coffee, 5G. And you see the problem. So what impact does that science communication have, which is maybe done at a government level, and then it creeps onto social media, like we see with, red dye 340, etc.?
Yeah, it's probably the biggest problem right now that we have in terms of the integrity of science and people's distrust of science, and figuring this out from a science communication perspective. I have a lot of friends who are science communicators, and we kind of talk about this kind of thing all the time. So let's take the red dye 3 example, right? So red dye 3, as you say, was recently banned by the FDA here, and I think corporations have a bit of time to get it out of the food supply. And it's not used that much in the US. It's used in like maraschino cherries and things like that. But red dye 40 is used a lot more. But red dye 3 was banned actually not because of any change in scientific evidence. It was changed because of something called the Delaney Clause, which is a legal clause in the US that shows that any substance, any additive to foods that has been shown to cause cancer in any model, in any animal model, human, animal, otherwise, must be banned, right? And so it's this old clause. And so what happened was studies came out in the 80s that showed that when you fed these male rats 4% of their body weight of red dye 3, they would get tumors. Just the male rats, not the female ones. And it was through a mechanism that's not suspected to be the case in humans. Like humans don't have this mechanism to be able to cause these same tumors. And as you say, those male rats, they're very susceptible to tumors, right? Because they have these different mechanisms. And we're not eating 4% of our body weight in red dye 3 ever. Not even close. You'd have to eat a lot of maraschino cherries to reach that. And so what happened was a scientific organization kind of submitted a thing to the FDA basically stating that we should ban red dye 3 because of the Delaney clause. And that was in 2022. So the FDA reviewed it, and they basically retroactively applied the Delaney clause to red dye 3, and that was why it was banned. So it was banned based on old studies that show these tumors in rats because of a legal clause. And so that was interpreted. I mean, I saw lots of videos on social media saying, it causes cancer in humans, right? So, which there's never been any evidence to show that it's detrimental to humans. And again, this was like literally 4% of these rats' body weights, like that even that dose, even if we had the mechanism in humans, which we don't, at that dose, no one's eating that dose. And so all of that nuance is really difficult to cut through when people are just making videos like red dye 3 causes cancer, and that's why they banned it. Finally, after years of inaction, they banned red dye 3. And the whole idea, right, is that the FDA is corrupt and they're poisoning us, and now like they're finally banning this like cancerous additive, and that it just is completely incorrect and is lacking nuance. But that nuance is so difficult to get through when you have those kind of inflammatory videos that do so well on social media algorithms.
The point you made there, when people fearmonger based on those ingredients, which are potentially synthetic or unnatural, that's kind of going into that appeal to nature fallacy, where someone takes a single ingredient out of context, even if it's got no proven causation or mechanistic link to disease, and make a claim just on its own. I guess even water in excess can be lethal, and I guess. A lot of claims that people make is that, the US allows certain additives and food dyes to be used in their products, and then they look across the pond, and those same ingredients are often banned or illegal in the EU. So why is there that sort of discrepancy, and why is this message of the US maybe not doing enough to regulate their food being sort of perpetuated?
Yeah. So, well, first of all, about 95% of the time when I see videos saying that something's banned in, let's say, the EU versus the US, it's not actually banned in the EU. So the EFSA has not banned it. They've said that it's safe, and it's just not being used in products in the EU, whether that's because of preferences of people in the EU, or it's because with, like, let's say, just even the food dyes, right? The major food dyes, we call them in the US red 40, which is Allura red, right? Blue 1, yellow 5, all of those food dyes, those main food dyes that I see videos all the time about how they're banned in the EU, they're not banned in the EU. And the EFSA has said that they're safe and they're able to be used in the EU. Now they will hold up, like certain products that we have and then the EU doesn't have, and say it's because of these banned ingredients, but it's not necessarily because they're banned. It's just because of consumer preferences of people in the EU. And so I think that's really important to understand that most of the time when people are saying there's banned ingredients in other countries, they're not banned. They're different names. They use E numbers in the EU. And so,
Exactly.
they don't realize that that's also red dye 40 is being used there. And then also, sometimes there are differences in what we allow versus what you guys allow. And we, I've made a video about this in terms of dyes. We actually allow less food dye than the EU allows. Now, whether or not we use less is a different story, but from a safety perspective, we allow less than the EU does. So, and there's multiple that I pointed to in that video that are banned in the US and allowed in the EU and used in the EU. I found different products and showed how those food dyes are used there, including dyes from metals like aluminum, gold, and silver. And so this idea that we are the only ones who use these ingredients that are banned in other countries is just not accurate. But we do have different regulatory frameworks. So the EU uses something that is more like a precautionary principle, is what it's called. And they look at kind of hazard, whereas we look at risk in the US. And so the best way I can explain that is hazard is there's a shark in the water. So is there a shark in the water? That would be a hazard. A risk would be, is there a human actually swimming next to the shark in the water? And so at the what that means is we take into consideration exposure. So if there is an ingredient that potentially could be problematic, but at what dose, right? Has it been shown to be problematic at 5% of your body weight, but you're exposed close to it at like, 0.01% of your body weight, then that's not going to be problematic. And then that would be allowed into the food supply. But if it's been shown to be harmful, as an additive, the FDA reassesses that, and they look to they look at EFSA. I mean, this research is done globally, so we can look at Health Canada, we can look at EFSA, and we can look at the FDA, and the FDA will do these like periodic updates. Now, I think they should be doing more periodic updates, and I think we should be funding the FDA more so that they have the ability to do more updates. But they'll do these updates, and if something is found to be detrimental, they ban it, just like they banned trans fats in 2015, right? These artificial trans fats that the EU didn't ban at that time, by the way. And I think they still allow like a very small amount of artificial trans fats, where we've completely outright banned them. And we banned BVO recently from some, not because it's shown harm, but because of the potential for harm in BVO's case.
I guess, what you've just highlighted there, this sort of cognitive dissonance is another example of misdirection where, if you take a pack of Skittles, for example, if you remove a bad ingredient or ingredients from the Skittles, the E numbers or any food dyes, and you made Skittles a uniform white color, it doesn't make Skittles a healthy option suddenly. So I guess it's, again, more credence to the claim that you can't just focus on those individual ingredients. Someone can have Skittles as part of a varied diet, maybe if they have, some Skittles, but, they're predominantly eating high protein, high fiber, movement, all those other things. So I guess that is papering over the cracks rather than focusing on fixing the hole in the sink.
Yeah, so exactly right. So think about in the United States, this is what our landscape we're working with right now. So we have an American population, over 90% of them aren't meeting fiber and vegetable guidelines. Over 70% of them are eating too many calories for their needs. 50% are eating too much added sugar. And then you combine that with 80% of them aren't meeting physical activity guidelines, right? So you have all of these like health behaviors at individual level that they're not meeting. And then you say, okay, well, I think, who cares about all of that? Who cares about like getting access to fruits and vegetables to people? Who cares about upping their fiber and educating on that? Let's focus on red dye 40 in Skittles, right? And removing red dye 40 and replacing it with, let's say, beet juice, right? Now, is that going to do anything for someone's health? Someone who's eating these ultra processed foods, if you remove red dye 40 and you put in beet juice, it is still going to be a high sugar, high calorie, ultra processed food that is not giving you any nutritional value, right? I'm not saying you can't ever eat Skittles. I mean, because by the way, we don't just eat food for nutrition, right? It's also nostalgia, it's enjoyment, it's all of these other things. But it's not, if you're trying to improve public health, that's not the public health measure. I did a video and I said on a scale from 1 to 10, in terms of like things that we could do to improve public health, that's number 10. Right? Addressing those like little ingredient changes in ultra processed food is number 10 on the list. And so when we are over focusing on that, like literally putting all of our focus into it with this Make America Healthy Again movement, it's really frustrating because there's only so much political will and energy for these changes for public health measures. And when you're focusing on the lowest totem pole, essentially, that's problematic because then you don't have any will or energy for all of the other things that could actually make a difference.
And just a caveat, neither one of us are sponsored by Big Skittle, even though we've mentioned it a couple of times. I guess one of your main focus areas as a dietitian is helping mums and mums to live healthier lives as well. And I see a lot of that misinformation, which adults, are affected by and influenced by negatively, can sometimes affect mums to be or mums who've got young children. And then the young children are exposed to some of the misinformation indirectly through their parents and their environment. These young kids will obviously eat what's put in front of their plate. And I guess when it comes to even things like infant formula, there seemed to be an active trend, or certainly something which happened, over the last few months, where people demonize formula milk. And I think that's been something, again, part of this natural trend where people say breast milk is best And formula milk, again, it's ultra processed. It has high fructose corn syrup. And there's a real danger, I guess, where we overcomplicate diet to the point where even our children and the youngest members in our society are really at risk of major problems because, as far as I'm aware, up to 12 months, the majority of nutrition should be either breast milk or formula feed, or potentially even a combination of both. And there's no need to get into any fancy diet. So I guess the real problem is when that misinformation trickles down and influences and affects our kids, essentially, there could be an increased risk of nutrient deficiencies, energy deficiencies, and all sorts of other problems.
Yeah, they're an easy target. So new moms are an easy target for fear-mongering information and infertility, pregnancy, and new parents. And so yeah, that I've really focused on that demographic quite a bit because they are such an easy target. Because when you're a new parent, and I just went through this life stage as well. I have a 5 and a 2-year-old, and when you just want to do what's best for your kids, right? And so when you're being told, this formula is poisoning your kids, like that can be very scary. So I try to kind of educate around the reasons for some of these ingredients. Like, let's just take formula. And so a lot of people who can't breastfeed or don't breastfeed, they need an option, right? A formula option. And so there's a lot of misinformation about formula, and it's really diet culture creeping into kind of infant feeding options. For example, there is no high fructose corn syrup in infant formulas. That's a video, like I see that all the time on social media. There just is none. Now there's glucose syrup in some of these. So basically you have the main sugar source, because breast milk is very sweet. If you've ever tried breast milk, it's very sweet. And the main sugar source is lactose. And so in every infant formula, at least in the United States, every infant formula manufacturer has a solely lactose-based formula that is mimicking the sugar content of breast milk, that doesn't have any corn syrup, anything like that. In some of these gentle formulas or hypoallergenic formulas that have to reduce the milk that's in lactose, so for example, some infants have milk allergies, or they even have something like galactosemia, where they can't have galactose, which is the main sugar in lactose. They have to have sugar from somewhere else, right? So if you have to reduce lactose or eliminate lactose, you have to get that sugar from somewhere else. And there's really only 2 other places to get it. You can get it from glucose and you can get it from fructose. But fructose is not tolerated well by infants. And so it's not used in these infant formulas. So they have to use glucose. And they do that. Corn is a good source of glucose. It's 100% glucose. So they'll use corn syrup in these infant formulas, these hypoallergenic infant formulas. They can also use maltodextrin, which is also 100% glucose. So it's really either or. But the reason is because you have to have sugar in infant formula, right? And so if you just see corn syrup and you've been told by the internet that corn syrup is evil and it's causing all of these issues in ultra processed foods, and you conflate it with high fructose corn syrup, which is over half of a different kind of sugar than corn syrup, because high fructose corn syrup is in all these ultra processed foods, you immediately think, oh my gosh, this is like an ultra processed food that is going to be like harmful for my child. When at the end of the day, those ingredients are so strictly regulated and they're meant to mimic breast milk as close as possible, right? And it's never going to be perfect, but as close as they can get to what the sugar composition would be in breast milk. And so that it's a perfect example of how people who don't really understand what they're talking about, but have this like fear of these ingredients because of social media, kind of target this really vulnerable population with misinformation. And it's really unfortunate.
I guess nutrition is one aspect of that, but sometimes that misinformation can really take deeper roots and actually have major medical impacts as well. For example, I've seen an increasing trend on social media, particularly, and in real life as well, where mothers and families sometimes refuse the vitamin K shot for newborns. And, obviously, we don't naturally produce vitamin K and we need it from food, and infants particularly who, without having vitamin K, which is crucial for clotting and the clotting factor cascade, blood clotting cascade, if they're at risk potentially of a major hemorrhagic bleed and having a medical incident as they're born. So that vitamin K shot reduces the risk of having that bleed. And so I guess when parents or individuals choose to ignore the vitamin K shot, that increases the risk of problems for that child. But then I guess that is tempered by the fact that a lot of children may not have a problem with the bleed, and that becomes, the sort of main newsworthy segment. Like, hey, we didn't take the vitamin K shot, and my kid's fine. Similar to, I didn't wash my hands and I've never got an infection. It's sort of that survivorship bias mentality, and it's looking at always the positive. Bill Gates didn't go to university and he's a billionaire, but look at all the other people that didn't go to university and, they maybe don't have a job or whatever. So I guess that's the sort of similarity where we only see the positive stories of maybe a alternative therapy, and we don't see the dark side of what happens if you don't do something that is medically and kind of evidence-based.
Yeah, well, that's one of the hardest things with public health initiatives, right? They're victims of their own success, is what they say, because many of us have never known someone who had polio, for example, right? Yeah. So we're like, why do we need polio vaccine? Nobody has polio. Not realizing that obviously it's because of the polio vaccine. And then with vitamin K, it's the same thing. The vast majority of infants are getting the vitamin K shot. I educate on the vitamin K shot a lot, and I'll say I think one of the issues is that there's so much information on social media, and that, for better or worse, that's where people are getting most of their information now, right? And the problem is that it's overwhelmingly people who don't have the background, don't have the education to be educating on that particular topic. And so they're not seeing medical professionals, they're not seeing scientists explain why you need the vitamin K shot, right? So the vast majority of people are only seeing one side. And it's a problem in terms of science communication. And this is a whole nother topic. I just had a conversation on it in terms of just the barriers to science communication on the internet. And how, many scientists, they can't monetize like these wellness influencers. And probably better than most people, how much work it is to just consistently put out good content, and to not be able to figure out a funding stream for that, and to just be consistently like have to deal with mean comments and like people like that, right? And it's kind of like, okay, well, why do I need to do this? I'm just going to go back to my scientist job and like work in the real world, right? And so we don't see this like this huge amount of people coming out to give science communication or medical communication, unfortunately. And so a lot of people, they just haven't had the opportunity to hear like, why does my infant need a vitamin K shot? Like you're just telling me, and I do think that this is a problem in our medical system. I don't know how it is over there, but here, our doctors don't have a lot of time with their patients. The average, appointment time is so short. And so they do oftentimes just say, okay, you're going to need a vitamin K shot and this and that. And a patient is left being like, well, why? And so then they go on to social media and they figure out, why do I need this vitamin K shot? And then they get into the algorithm of people just, telling them how scary it's going to be and why they don't need the vitamin K shot. And then they go back to their doctor and they're like, I don't want the vitamin K shot. And so I think that it's a problem that we have to figure out in terms of our ability to educate people on why these things are needed, because people are interested. And I don't think as many people who are, avoiding some of these things would be avoiding them if they had the opportunity to have an explanation as to why they're needed.
It's an interesting point you raised there, in terms of those entry barriers to experts, scientists, doctors, and people with legitimate credibility getting on these platforms to communicate their expertise. And a lot of that is, they hold day jobs, which are very busy and very time consuming. And the social media is almost at the hobby stage where in their spare time, they'll try and create videos. And, I don't know about you, but sometimes, it can take me upwards of an hour just for one short 60, 90-second video, which is a lot of time, and it can take even longer. And I guess a lot of these other people online who can find ways to monetize either through adverts, which, is not a problem at all, or even selling something like a course or a supplement. And there seems to be a rise in, people selling supplements. The question I have is the same problem we have in the UK and probably world over. There are obviously some supplements which are great. I mean, I take some supplements. I take, I don't really eat fish. I take omega-3 supplements. I take creatine because I train, and I take vitamin D as well. I've recently found out I was very deficient in vitamin D. I live in the UK. Thanks for that. and there's lots of very good supplements which people can take, even if they're sort of quote unquote healthy. But then, it's still, even if those supplements are, touted to be good based on evidence, that industry isn't regulated. In the US, it seems like there's even less regulation to some degree. So why isn't the supplement industry regulated despite, a lot of these products which can have medical implications, interact with drugs people are taking, and have clinical effects on people? So why is there such a lack of regulation to the point where someone can sell a supplement, or a company can sell a supplement, and that supplement does not have to even match up to the labeling?
Yeah, the answer is because there's strong lobbying groups for the supplement industry, and there's a whole history behind this. I did a video on it once, and they essentially lobbied. The FDA wanted more oversight, and they lobbied against it, and it went through Congress, and an act was passed saying that they didn't need to go through regulatory oversight at the FDA. And so what that means is that we have a basically unregulated industry. Now there are some kind of like examples where the FDA can have oversight, but it's certainly nothing like the food and drug industry. And so, it's the most ironic thing ever is that a lot of the people who are so upset about lack of FDA oversight on food, or they'll be upset about like food additives, but like willingly take lots and lots of supplements that have almost no oversight. And so what that means is that there have been many, many examples of supplement companies where they'll test the supplement and they won't even have some of the ingredients that the label says that they have, or they'll have ingredients in them that aren't even listed on the label. And that happens quite a bit. Or we have like Amazon here, right? And Amazon recently has cracked down on this, but prior to that, third-party sellers were basically just like reselling supplements that they had like altered, and were selling them to people. And it's a real problem because we don't have a lot of oversight in that area. And the wellness industry is way bigger now than the pharma industry. And so it's a pretty big industry and a powerful industry. And so they don't want to have that oversight. And so they work really hard to not.
And I guess online, there's some major concerns about the FDA. And, you mentioned about their lack of ability to regulate supplements, but also there's been something brought to light increasingly online, and it almost seems like a conspiracy too good to be true, that there's a link between FDA and Big Pharma. And obviously, it depends how you paint that narrative, because there's obvious reasons there can be links between the two. The FDA will obviously charge pharmaceutical companies for various things, and it's, that tax is used to fund the FDA, or at least, fund a proportion of the budget. But I guess the perspective online is that Big Pharma controls the FDA via this sort of funding link between the two.
I'm glad you bring this up. It's a really big misunderstanding in terms of pharma funding to the FDA. So about almost half of the FDA's budget comes from the pharmaceutical industry. So that's true,
Wow.
right? And so that's the truth that people are using to kind of create these conspiratorial narratives. Now, where that funding comes from, it's not in like direct payments or lobbying money. It's nothing like that. It's user fees, right? And so most regulated industries, if you think about it, have user fees. And now I'm not pro or against this. I'm just kind of laying out what it is, right? Because there's good conversations to be had either way, but like honest conversations, not conspiratorial conversations about corruption that may or may not exist. So basically, user fees are like, if you go get a driver's license, right, you have to pay a fee for them to process the driver's license in America. The airline industry is regulated and they have to pay user fees. They have to pay these fees for this regulatory oversight that they go through. So it's just a standard fee that a pharmaceutical company has to pay in order to go through the process of having a drug reviewed. The safety of a drug reviewed. Again, it's very standard. So the reason that it happened was it was an act that was passed in the early 90s because the drug approval process was so slow because they didn't have enough staff at the FDA. And so to speed that drug approval process up, in order to get more things to market to kind of help people, they implemented these user fees where pharmaceutical companies would have to pay a set fee, and that fee would fund all of the people that were needed to kind of go through this safety process. And so that's been the case case. It's always been very strongly supported kind of in a bipartisan way because it meant that we had to pay less tax dollars at the FDA. And so that's what gets lost in this conversation. If you get rid of those user fees that funds nearly half the FDA, you have to make up that money from tax dollars.
Yeah.
So we have to put more of our tax dollars into the FDA, and we, the taxpayers, are paying to assess the safety of these pharmaceutical drugs instead of the pharmaceutical companies who are creating the pharmaceutical drugs and going to make all of the money off of them. So if you position it that way, it kind of seems like, well, that doesn't seem very fair that we the taxpayers are going to pay to go through the safety process for these pharma companies. Why would they not have to pay for that process? But again, if you just position it like half the funding from the FDA comes from the pharmaceutical industry, it seems pretty shady, right? But it's really, it makes sense if you think about it in terms of what it actually is, which is these user fees to process applications.
And I guess that is the basis of how a lot of this health propaganda is positioned. I mean, the online spaces allows people like yourself to provide evidence-based information and educate people and raise the level of health literacy, which is probably very, very low globally. And the problem is, how does someone spot propaganda? So the average person who doesn't know who you are or doesn't follow you, for example, or any other credible scientist or nutritionist or doctor, and they just see two people online, both are doctor whatever, and both have got completely polarizing viewpoints on the same subject, be it vaccines or seed oils or even high fructose corn syrup or ultra processed foods. What is something that someone can look for to actually tell who they should listen to almost, and how to spot misinformation and propaganda?
Yeah, so I try to, this is one of the things that I do try to do is kind of like walk through this in terms of, just like arming people with the ability to spot propaganda, right? Instead of having to go through every single piece of propaganda online, which is really difficult to do. So usually what happens is there's really strong language used, right? Like it's like inflammatory language, like poison or toxic or killing you or these sorts of things, right? Usually people giving evidence-based information are not using that language. They're just not. That's really a marketing. That's marketing focused. Then they're going to kind of, generally what happens is they'll use kind of like some truth. They'll use like a piece of truth, and then they will completely make up the rest of the story, right? Because it's the truth. It's the little bit of truth that gives the rest credibility, right? That because if somebody was just saying all nonsense, you would be like, this is nonsense, right? But it's that truth that's like, it hooks you, and then the rest is kind of BS. And then almost always they're not going to cite anything, and if they do cite something, it's not going to actually validate what they're saying. But generally, there's nothing referenced or anything like that, right, in a propaganda piece. And then they'll almost always sell you something at the end of it, right? It'll be like, comment, I just did one yesterday, and it was like saying a lot of incorrect information about ADHD and diet. And so it was the exact playbook. They used inflammatory information. Then they did cite something, which is rare, but the citation they used didn't corroborate anything that they actually said. Like I went through each piece, and nothing was in the reference that they gave. And then the last slide was them selling the solution to the problem they made up. And that's always how it is. And so they're selling you, I think they were selling like a brain detox or something like that. Then after all of that, if it is like someone with doctor behind their name and they're saying something that you heard an otherwise expert say the exact opposite, I would just say look up their credentials. And if they don't have their credentials listed in their bio and it just says doctor someone and their credentials aren't there, they're usually not giving accurate information. That has been my experience, at least. And they're using their credentials to appear to be an authority in an area that they're not actually educated on, and that happens all the time, right? So you'll have, let's say, a chiropractor saying, and they go by doctor, whoever, and then you go to their profile and it doesn't say what their doctorate is in, right? Like if you go to my profile, you'll see PhD in nutrition science, dietitian. If you go to yours, I'm sure it'll say the same thing, right? If you go to a chiropractor's, not all, there's some good ones out there, but if you go to a lot of these profiles, it'll just say Dr. So-and-so, no credentials anywhere to be found. Yep. And then you look at their content and they're an expert in seemingly every single thing under the sun. And you're like, how are you an expert in so many things? And expertise is really specific. And so if you have somebody who appears to be an expert in cancer, and then they're an expert in ADHD, and then they're an expert in nutrition, and then they're an expert in cardiovascular disease, it's usually someone who's not giving you good information.
I think hopefully, my aim would be, and hopefully echoed by yourself, is that someone listening to this conversation is hopefully armed with the right tools to not only spot misinformation, but hopefully has some degree of understanding of just the complexities of nutrition space online, but also health policy and the landscape. And there are so many obstacles which face all of us, certainly, people in America, when we want to say, do this, kind of like everyone can stand on their soapbox and say, you need to do this to be healthier. But sometimes the challenge isn't our own habits or our own choices, but the choices that we're presented with, which, actually it's not even up to us to change. It's from a government level. And I guess really that's the fundamental issue. Unless those main core root issues are solved, we're still going to be seeing a lot of these major issues, regardless of if we stop artificial sweeteners, stop food dyes. We need policy change from the top down to sort out, the health disparities in socioeconomic status, food policy, lobbying, from an agricultural point of view, and all of those things people don't really even know about.
Yeah. I try to explain it. It's the difference between individual health and public health. I'm a dietitian, so if I'm working with you one-on-one, I don't do this anymore. But if I were, what would my advice to you be? It wouldn't be to try to go change agricultural subsidies, right? My advice to you would be try to increase your fruit and vegetable intake, try to increase whole grains, try to get protein at every meal, try to reduce your intake of these ultra-processed foods and added sugars and things like that. So that's what we would work on an individual level. But on a public health level, that's not what we're working on. What we're working on is systemic change. We're working on modifying agricultural subsidies, decreasing food deserts, improving economic stability, regulating these industries, these corporations that are able to do whatever they want right now, and regulating the marketing that they're targeting these low-income people and children, and then looking at like school food policies and school lunch policies. That's public health, and so I do think that many people focus only on individual choice and think that everybody needs to just focus on individual choice, when, again, as we talked about, they're really being set up for failure by these systemic policies that are really positioned to help corporations and help enrich people at the top, versus helping to actually improve public health and our food system as a whole.
Thank you for providing a lot of good science and not just sensationalism. So, it's been refreshing having you on this podcast, Jessica. Thank you very much.
I really appreciate you having me. Thank you.